This is exactly what happens to your eyes after 60, and why everything you've tried to fix those puffy bags probably hasn't worked. 76 years of practicing medicine, 18-hour workdays until just months before his death at 105, and over 150 books published after his 75th birthday. That was Dr. Shigeaki Hinohara of Japan. Millions have studied his approach to longevity, but very few have connected his philosophy to something that bothers so many of us as we age: those stubborn, puffy bags under our eyes. What actually works to reduce puffy eyes after 60? According to the world's top medical institutions like Johns Hopkins, the Mayo Clinic, and the Cleveland Clinic, is what I'm sharing today. Some viral remedies that could actually harm your skin need debunking. And there's a simple 5-minute morning routine that addresses the real reasons your eyes look tired. But here's the thing. You need to understand why this happens in the first place. Because once you know that, everything else will make sense. Section 1. Why your eyes change after 60. Less than 1 millimeter thick. That's how thin the skin around your eyes is, the thinnest on your entire body. And here's the part that shocked me when I read it. This area ages 22 to 28 years faster than the skin on your temples. Think about what that means. At 65, the skin under your eyes has effectively aged like it's in its late 80s or even 90s. Something called the orbital septum starts weakening after 60, and this membrane holds the fat pads around your eyes in place. When it gives way, those fat pads push forward. That bulging, baggy appearance that no amount of sleep seems to fix comes from this structural change. Collagen loss compounds the problem, somewhere between 1 and 1.5% disappearing every single year, which means less support, less elasticity, it's more visible puffiness. Another factor makes this worse, and it affects nearly half of all older adults: sleep quality. The numbers tell the story. 43.6% of adults over 70 experience poor sleep. Lying flat all night lets fluid pool around your eyes through simple gravity, and poor sleep means your body never gets the chance to properly drain that fluid. 24% of older adults live with chronic dehydration, which might surprise you. You'd assume less water in the body means less swelling, but the opposite happens. A dehydrated body holds on to water wherever it can, including right under your eyes. Certain medications create another obstacle that many people over 60 don't even know about. Calcium channel blockers, beta blockers, NSAIDs, and corticosteroids can all trigger fluid retention. If you're taking any of these, discussing it with your doctor might be worth your time. The picture is clear now. Ultra-thin eye skin that ages fast, weakening structures that hold everything in place, accumulating fluid, and lifestyle factors that make it worse. What actually works to fix it is the next question. Section 2. What the medical experts actually recommend. Hours of going through recommendations from Johns Hopkins, the Mayo Clinic, the Cleveland Clinic, and the American Academy of Ophthalmology revealed something consistent across all of them. Cold compresses earn the strongest medical consensus. Almost too simple, right? But the science behind it is solid. Cold temperatures trigger vasoconstriction, a fancy way of saying your blood vessels narrow. Narrower vessels mean less blood flowing to the area and reduced fluid accumulation. The result is reduced puffiness. Cool temperatures work best, not freezing, because you don't want to damage that delicate skin. 10 to 15 minutes with a cold compress does the job. A chilled washcloth works perfectly, and so do refrigerated spoons, which explains why professional makeup artists keep them in their kits. Sleeping with your head elevated appears everywhere in the research, and it's even simpler. The Mayo Clinic specifically advises adding an extra pillow or raising the head of your mattress. And the reason connects to what I mentioned earlier about fluid pooling when you lie flat. This approach solves the problem at its source, preventing puffiness from happening rather than treating it after the fact. Waking up with puffy eyes that improve throughout the day signals something specific. Gravity and fluid accumulation overnight are your main culprits. What you eat plays a role too, and here's a statistic that caught my attention. The World Health Organization reports that adults consume an average of 10.78 grams of salt daily. It's more than double the recommended 5 grams. Excess sodium triggers water retention that becomes especially visible under that thin eye skin. Limiting intake to under 2,300 milligrams daily can produce a noticeable reduction in fluid-related puffiness. But here's the thing, it takes time. 2 to 4 weeks for your body to adjust is what you should expect before seeing results. One more technique has moderate evidence behind it, from an unexpected source. Lymphatic drainage massage. Tori Harshaw, a massage therapist at the Cleveland Clinic, puts it this way: manual lymphatic drainage may lessen congestion and decrease puffiness by moving excess fluid back into circulation. But here's the limitation. Only fluid-related puffiness responds to massage. Fat pads pushing forward from a weakened orbital septum present a structural issue that massage won't fix. Medical intervention becomes necessary for that. For everything else, lymphatic massage can add real value to your routine. How to do it correctly comes in a few minutes. Section 3. Popular remedies. Do they actually work? Some remedies plastered all over the internet work, some accomplish nothing, and some could actually hurt you. Cucumber slices come first. That image appears everywhere. Someone at a spa with cucumbers over their eyes, completely relaxed. Cucumbers contain vitamin C, vitamin K, and flavonoids, which sounds impressive. But the research tells a different story. The Pharmacophore Journal noted in 2024 that there's a notable lack of clinical research to back their efficacy. Cucumbers do provide some benefit, just not for the reasons you've heard. The cold temperature does the work, not any special compounds in the cucumber itself. Tea bags fall into the same category. A 2011 randomized, double-blind study examined caffeine gels and their effect on eye puffiness directly. The conclusion found that the cooling effect of the hydrophilic gels was the main parameter in reduction of eye puffiness, rather than the vasoconstriction of caffeine. Only 23.5% of volunteers responded to the caffeine activity specifically. For everyone else, cold was doing the heavy lifting. The practical takeaway becomes clear. Cucumber slices and tea bags provide temporary relief, and using them is fine. Just know that cold temperature is the active ingredient. A chilled washcloth or refrigerated spoon delivers the same results. Eye exercises sound promising, but the evidence doesn't support them. Videos claiming that certain exercises reduce puffiness and tighten eye skin have spread widely. A 2018 study did show that facial exercises improved cheek fullness over 8 weeks. But here's the problem. No robust clinical studies specifically prove that eye exercises reduce puffiness. Most claims floating around online rest on theory or anecdotes rather than scientific evidence. They might work, but proof that they do doesn't exist yet. Gua sha and jade rollers have exploded in popularity, especially on social media, and some truth backs them up. A 2023 review in the Journal of Cosmetic Dermatology found that these tools increase both blood and lymphatic flow. But the catch is significant. Results last only hours. Harvard-trained dermatologists at the Boston Derm Advocate were direct about this, stating that no research backs the use of gua sha as an anti-wrinkle treatment. Enjoying a jade roller as part of your morning routine is fine. Just understand that temporary improvement is all you're getting, not a permanent fix. Now comes a warning about something dangerous: hemorrhoid cream. This so-called beauty secret has circulated for decades, with the idea being that since hemorrhoid cream reduces swelling in one area, it should work under your eyes too. Do not do this. Dr. Shirin Idris, a board-certified dermatologist, warns directly that Preparation H as an eye cream hasn't been tested for safety on the face or around the eyes. The ingredient that supposedly helped, called LYCD or Biodyne, was banned by the FDA back in the 1990s. Long-term use near your eyes can cause skin thinning and even burns. This viral tip sounds clever, but could genuinely harm you. Avoid it completely. Section 4. Japanese massage techniques. Japan holds one of the highest life expectancies in the world, and centuries of developing facial massage techniques have produced results that align with what we know about lymphatic drainage, even without extensive clinical validation. 3 techniques stand out. Kabuto massage dates back to 15th century Japan, originally reserved for the empress. Acupressure, shiatsu, and lymphatic drainage combine in this approach. Gentle movements toward your lymph nodes form the key principle, with these nodes located in your neck and below your ears. Pushing hard isn't the goal, guiding fluid toward the areas where your body can naturally drain. It is Kurugi massage, developed by therapist Chio Hayashi, targets deeper tissue layers. Press your knuckles gently against your cheekbones to start. Slide along your brow line with moderate pressure. Always finish by stroking down your neck to complete the lymphatic loop. That last step matters because it gives the fluid somewhere to go. Asahi massage, also known as Zogan, addresses eye puffiness specifically. And learning it means you can complete it in less than 60 seconds. Press your middle fingers at the outer corners of your eyes to begin. Slide gently along your lower eyelids toward the inner corners. Arc upward, following the line under your eyebrows. Repeat this 3 to 4 times. Finish by stroking down your neck to drain the fluid. What I mentioned earlier about lymphatic massage working only for fluid-related puffiness applies here too. These techniques help your body move excess fluid out of the under eye area. Structural issues won't change, but morning puffiness can improve with consistent practice. Section 5. Your 5-minute morning routine. Everything comes together into a simple routine you can do every morning. Taking less than 5 minutes and combining the most effective natural remedies. Minutes 1 and 2 involve applying your cold compress. Refrigerated spoons, a chilled washcloth, or cucumber slices all work. Apply while sitting upright, which allows gravity to help drain fluid downward rather than pooling around your eyes. Minutes 2 to 3 focus on cleansing gently with cool water. When you pat dry, use upward motions, supporting the natural direction you want fluid to move. Minutes 3 to 4 are for applying eye product if you use one. Look for something containing caffeine. Apply it with your ring finger, which naturally uses the lightest pressure. Tap gently from the outer corner toward the inner corner. Then continue under your brow. Dr. Marissa Garshik of MDCS. Dermatology recommends keeping your eye products refrigerated because the cool temperature helps shrink the blood vessels under your eyes. Minutes 4 to 5 complete the routine with quick lymphatic massage. Start with light sweeps from your ear down to your collarbone to open up the drainage pathway. Follow with gentle circular motions around your orbital bone, moving outward. Finish with downward strokes on your neck. 5 minutes total. But what you do the night before matters just as much. Avoiding fluids 2 to 3 hours before bed reduces the amount of fluid available to pool around your eyes overnight. Reducing sodium intake throughout the day helps too, remembering that most people consume more than double the recommended amount. Sleeping with your head elevated on an extra pillow makes a difference. 7 to 9 hours of uninterrupted rest is the goal. Though given that over 43% of adults over 70 experience poor sleep, this might prove the most challenging part. It's also one of the most impactful. Section 6. Dr. Hinohara's Philosophy and Healthy Aging. Published works from Dr. Shigeaki Hinohara don't specifically address eye health, but his approach to longevity contains wisdom that connects directly to what we've covered today. His words capture something that matters. Energy comes from feeling good, not from eating well or sleeping a lot. We all remember how, as children, when we were having fun, we often forgot to eat or sleep. Skipping meals or staying up all night isn't the suggestion here. But something underneath those words deserves attention. Chronic stress elevates cortisol, which causes fluid retention. Living with purpose, engaging with life, doing things that bring joy, all of these naturally decrease stress levels. 18-hour days continued well into his hundreds, not because anyone forced him, but because meaning filled his work. Purpose stayed alive for him. Physical activity remained part of his routine. Contribution mattered more than accumulation. Better sleep and better circulation connect to all of these factors, both of which directly impact how your eyes look and feel. Consuming olive oil daily was his only documented skin-related advice, something he credited for both arterial and health. Addressing puffy eyes isn't just about what goes on your face in the morning. How you're living your life overall matters more. Conclusion: everything connects when you pull it together. Straightforward approaches work best for reducing puffy eyes after 60. Cold therapy, proper sleep positioning, reduced sodium, adequate hydration. Japanese lymphatic massage techniques can add temporary benefits when performed consistently. The biggest insight from all this research surprises most people. Most special ingredient remedies work primarily through cold temperature. Expensive treatments rarely outperform a refrigerated spoon. Addressing underlying lifestyle factors matters most for those of us over 60. That 43% poor sleep rate among older adults, 24% dehydration prevalence. reviewing medications that might cause fluid retention with your healthcare provider. Structural bags from fat pad displacement do require medical intervention, but fluid-related morning puffiness responds well to these simple, evidence-based practices that cost nothing and take less than 5 minutes daily. One final note from the American Academy of Ophthalmology deserves attention. Any swelling that lasts longer than 24 to 48 hours should send you to an eye care professional. Persistent puffiness can sometimes indicate allergies, thyroid issues, or kidney problems that need medical evaluation. Taking care of your eyes matters because they're one of the first things people notice about you. These simple changes can make a real difference in how rested and vibrant you look, regardless of your age. See you in the next video.